And okay, let's start. Let me put the timer first.
Openness. Okay.
For 9 minutes.
Hello, Selmi.
Yeah, start.
Good evening, Ms. Matt. I'm Dr. Saleh, one of the surgical doctors. I'm really sorry you have been waiting too long to see Mr. Matt.
Yes, doctor. I've been waiting for like 3 hours now. I don't know what's going on.
Yeah, I apologize again for that. Unfortunately, Mr. Mann has been called up for an emergency.
But
so
you
he
are
will
not
be able
you are not Mr. Man, right? I was expecting him.
No, I am one of his team. I am one of the surgical doctors here covering for my consultant. He have been called for an emergency. So he will not be available with you at the right moment. But for sure, I can arrange another meeting. I will tell him personally you were here for him.
Yeah, but you telling him personally will not solve the problem, right? So what's
Well,
going on, doctor? Is there any update? Like, what's the issue?
Yeah.
Please update me. I know nothing about. Like, do you have update for me?
Yes, I want to assure you that I'm well knowledgeable of your husband's case and I'm well updated. So I'm here to discuss with you what's happening and what do you know so far, Ms. Matt.
I know there's some investigation or something like that that need to be done, but that's all what I know. Nobody,
So-
I was left in the dark, to be honest, doctor. Nobody's talking to me, and you're always busy. You don't answer your bleeps or your calls. I asked the nurse a couple of times, but nobody replied.
Well, it must be a tough situation for you, Ms. Matt. I
Yeah,
understand that totally. So I'm really sorry for this inconvenience, but emergency settings have to be prioritized. And I'm here and I'm gladly to help you, Ms. Matt. So as a quick sum up,
Yeah.
your husband came up a few days ago with a tummy swelling. Is that right?
Yeah, I'm aware of that.
Yeah. That tummy swelling has been present for more than 6 weeks, I think. Is that right?
Yeah, I'm also aware of that.
So you have been sent to do an investigation, which is a CT scan of his tummy. But unfortunately, our CT machine is broken now.
Okay. Your CT is
Unfortunately-
broken. How inconvenient is that, doctor? That's a shame.
Well, I understand that, and I agree with you that we may be a small hospital, and we don't have an over resources. But you have to know that your husband.
Okay. Before you jump to that, doctor, I just want to know why is the CT required from the start to begin with?
Well, that's a very good question. Thank you for raising this question. Well, as I told you, he has a tummy fluid, which some of this fluid were sent for analysis, and they came up showing cancer cells, Ms. Matt.
Okay.
So we need to do CT scan to know from where these cancer cells come and how much is spread. Are you following me?
All right. Yeah, I'm following with you. I just want to make sure, like, are you sure the CT scan will tell you where the origin of the cancer?
Well, we will have to do more investigations. Like we may need to send some fluid again for analysis to tell the exact type of cell in this fluid. But CT will give us a clue about what's happening inside the stomach.
All right. And you said your hospital is impotent and the CT machine is not working. So do you have any other alternatives?
Well, as I told you before, we don't have an over resources, but ideally for such patients, we do all the necessary investigation within 2 weeks time frame. I want to assure you that we will not let your husband. If we think he need to be transferred, we'll transfer him immediately. But there are other alternatives I would like to discuss with you if you want.
Yeah, okay. I will come to the alternative, but I just wanna like understand completely what you're saying. So you're gonna keep him for 2 weeks in hope that your CT scan will be fixed. And if it's not fixed, then you're gonna transfer him. Is that what you're saying?
Yes, we will transfer him to another hospital so he can
Okay, why
do a
not?
CT
Why not?
scan and come back to.
Why not transferring him from now then?
Well, as I told you, there may be alternatives for this investigation. So we don't want to overburden you with all transfer and come back.
That's fine. Tell me about the alternative. What alternative do you have?
As alternative, first we can start by simple tummy ultrasound scan, which is like daily scan of pregnant ladies. It will give us an idea about the liver, if it contains any suspicious spots, and also amount of fluid inside the stomach mismatch. Another helpful investigation, which is an MRI, which is an equally helpful as CT scan. But for this, we would like to wait for Mr. Mann's opinion. And as I told you, as a last resort, if we need it, we will transfer him to do CT scan in another hospital.
That's fine. And is it cancer, doctor, now? Like you told me there's a cancer cell, but you didn't confirm for me, is it cancer or not?
Well, to be honest for Ms. Matt, in order to tell someone he had a cancer, I must be prepared and ready to answer the following questions, which will be like, from where these cancer cells came and how much it spread, and what are the treatment options and modalities, and what is the prognosis for this. So for now, in our hands, we only have the analysis of fluids, which shows it's cancer cells.
Okay. Yeah, that's fine. So it's a cancer, but it's not a cancer. Is that what you're saying?
Well, for now, we have the fluid analysis, which tell us it's cancer cells. We need to do more investigation before I can tell you what's the type of this cancer and what the treatment options available.
Do you think that he will need the surgery, doctor? Do you think the surgery is needed in his case?
Well, generally in cancer patients, we do surgeries in cancer patients, but in your husband's case, the presence of tummy cancer nasty cells inside his stomach gives a strong impression it's advanced cancer, and he's unlikely to get benefit from surgeries. So it would be unkind to put him in pain with little or no benefit at all.
I knew you were gonna say that. So you're gonna let him die. So you're just gonna let him die then?
Well, that particular I didn't say. I didn't mean that. There's other modalities for palliations. We will not let your husband suffer, Miss Matt.
There's no suffering more than this. That's fine. His brother is not right here in United States of America, and I want to tell him to come and see his brother. What do you think? Okay.
Well, we encourage family support, but you have to consider patient confidentiality is our priority here. And also, for now, we only have the fluid analysis, which shows cancer cells. But my suggestion for you is to wait for 2 weeks, which after that we will come and exactly tell you what is the condition of Mr. Matt.
Okay, I think that makes sense. Fine.
Yeah. So you have any other concerns?
No. No.
I want to assure you that your husband is in safe hand, and we are all here to support and guide you. If you have any concern or any further questions, please do not hesitate to contact me, Ms. Matt.
All right. You have 20 seconds.
Okay, just to quick sum up, Ms. Matt, your husband came up few days ago with stomach swelling, and he need to do CT scan. I told you we discussed that CT scan is broken here. We discussed the alternative options. So do you have any further question?
No, that's fine.
Thank you for precious time, Ms. Matt.
Fine, you finished just with the times, 9 minutes. Good, Saleh. Very good presentation. I think you answered all the questions right. I don't have any comment on your grammar. Your grammar is very good. You just need to be a bit faster. You tackled the new question in a very good way. And that's what I'm going to train every one of you. Don't memorize what's already written. Always prepare yourself for challenge, which you did in a diplomatic way. I'm very happy with your performance. And
Thank you. Appreciate it.
just try to avoid, as I told you before, because people here in UK consider it a bit rude. So I know back home when you say, as I told you before, it's like it doesn't matter. But here it does consider like a rude word. So if you said it once or twice, but you said it like 4 times, as I told you, as I told you, as I told you, as I told you.
Yes, yes.
Delete this from your vocabulary, as I told you. All right?
Okay, okay.
And I don't have any comment, Muhammad, and the rest of the group. Muhammad, if you have comments.
Saleh, you did very good. But Ali, did you ask about why this patient have breathlessness?
I did.
No.
I did it.
Yes.
Okay, could you please give me the answer, Saleh?
Well, this is due to presence of fluid inside his tummy. This pushing his lungs upward, making breathing difficult. We can discuss with Mr. Mann if we can aspirate more fluids. Also, there is mitigation which will help him get rid of this fluid.
All right. And I'm glad you mentioned that. If your simulator or the patient that you're taking history from forgot to ask you about the question, they will not count that. So it's not your fault I didn't mention the question. But if you remember for whatever reason from the scenario or from the file, it was mentioned the patient has shortness of breath, then even your patient didn't ask about it, you just say it for the sake of completion. Okay?
Okay.
All right.
Yes.
Good, Saleh. Did your exam was confirmed?
Thank you.
Was your exam confirmed?
Yes. They sent a confirmatory email.
August, Abu Dhabi.
August, yes.
Okay.
Penang, Malaysia.
The next station is arthroscopy.
Hello,
I think we
Assalamualaikum.
have difficulty in arrangement. Ali,
Sorry?
who choose arthroscopy first?
It's already in Telegram. I'm not sure. Let's check.
No,
Okay.
Asia was asking. Asia chose TKR. I chose arthroscopy.
You are the first one to choose it, Sahab?
Yes. Sahab is the
Yes.
first one to choose arthroscopy.
Let's do it then.
So,
Arthroscopy. I will
She
be.
chose the
is there
different
anyone
station.
want to be the patient for arthroscopy?
Me,
Salma Zahran, I think.
Salma Zahran.
yes,
Would
You want to be the patient?
yes, I am the patient.
Okay.
Very
All
nice,
right.
Salma.
It's
My voice is clear.
Huh?
Yes.
My
Excuse me?
voice clear.
Yes,
your
it
voice.
is clear.
Yeah. Okay. Let me put the timer. Yeah, start.
Hello, good morning. Can I have the scenario, please?
Okay.
Yeah. The scenario is in the school. Arthroscopy cancel.
Okay.
Go to your patient and tell him about the canceled arthroscopy, absorb his anger, and make him leave the hospital happy.
Good morning. I am Dr. Sahar, one of the surgical doctors working in this hospital. May I confirm you're Mr. Richard?
My name is John. Is it my turn now for the operation, Dr. Sahar?
Hello, Mr. Joan. Nice to have you here today. I understand you've been waiting anxiously for your operation, but I am sorry to tell you that it's not going to happen today.
What? What do you mean by that? I already postponed for the last month.
I understand, Mr. John, and I apologize for this inconvenience. But
Would you call my consultant, please? Would you call my consultant, Dr. Sahar? I just want to talk to Mr. Mann.
I'm sorry, Mr. John, for this inconvenience, and I understand your frustration, but Mr. Mann is caught up in an emergency case right now, and I'm afraid I cannot reach him.
Okay, bring another consultant to do.
I apologize again, but another consultant has to be aware of your condition, and I'm afraid he has to go through your case from the start, and that will be time consuming.
So, could you do it?
I'm sorry, but I am not authorized to operate without supervision.
So you cannot solve my problem now. What I can do?
I'm sorry again, Mr. John, but what I can help you with is try to prioritize your case in the next schedule that comes up as soon as possible. But I cannot give you a certain time or date. I'm sorry about that.
Are you
Should
joking?
another
You have all
No.
the problems, but not a single solution. Every time there is one doctor come here and said that Mr. Man is an emergency, and we will put you in early appointment and give you early appointment, but nothing happened.
I
So I
understand.
will lose my knee, I will lose my leg.
Hopefully you will not lose your leg, Mr. John, and I do understand where you're coming from and your frustration. And as I said, I will try to prioritize your case, but should there be another emergency that comes up, we should prioritize it again. And I'm sorry that your case or your condition has been postponed for a number of times, but it is, rest assured, it is due to emergencies.
So how can I work now?
I can be of little help, that can provide you a sick note to give to your employer, or write an email that you cannot perform or carry on with your current designation or work, and that you should be resting.
What about the pain?
For the pain, I can give you some painkillers that can help ease your pain and discomfort.
So can I walk on my legs?
For sure, it is important and vital to stay active and move around, but not to do any strenuous exercises. I can recommend exercises like swimming to keep you active, and not put any pressure on your knees. Something else I can help with is refer you to a physiotherapy specialist to give you some more exercises that can help with your condition.
Okay, but I have heartburn, doctor.
I'm sorry about that. I can give you something to help with the heartburn. I can also advise you to stay away from a drug called diclofenac that can cause ulcers or tummy upset.
But the diclofenac is good. My pain become better after I take diclofenac.
Yes, I can give you similar painkillers that with similar effect, but not causing any upset to your tummy.
Okay.
Do you have any further questions, Mr. John?
No, thank you, doctor.
Okay, just to, before concluding, I'd like to summarize what we went through. I've mentioned that your operation has been postponed again today due to an emergency that came up. I did apologize for that, and I understand your frustration, and promise to keep you as a priority in the next upcoming schedule, given that there is no another emergency to overcome your situation. And I would let my consultant know about your case. I'd like you to note down my number and my contact if you have any further questions anytime. And thank you for giving me your time to explain and understand.
Thank you.
Thank you. Goodbye.
Good. You still have 3 minutes and 40 seconds. You finished in a good time, good presentation. Your grammar, your English is very good. Sahar, you nailed it. That's a pass. As Saleh, both of you gonna pass. Everyone here gonna pass. Our goal is 100% pass. I'm very happy with your performance.
Yes.
But there's only one thing, Sahar. I don't know why, but I like the feeling of you being very sympathetic with the patient. I didn't get that. I think from your tone, the way you speak, seemed to me very unsympathetic. Even though you say sorry, but it's like
Normotonic,
someone,
yes.
It's
yeah,
not true.
someone who doesn't mean it. Selma, you were the patient. Did you feel that he is very sympathetic with you?
No,
أنا ذاتي
Yeah,
I didn't
By
feel I
her
was
words,
mono
by her
I
words,
was
it's so
monotonous
sympathetic.
the whole
I
yes.
just,
yes. Look, no.
أنا
Look.
ذاتي I did not feel it.
we
Look,
just
I don't know.
practiced this station.
I
Dr.
don't
Ali,
know.
we just practiced this station before the meeting, and I was very angry, and I was.
Yeah.
She tried to be calm, to make me calm.
Okay, so you practice together then.
We did, yes.
Yes.
Yes, very good.
Good. That's very good. I do encourage that. Please practice with each other, especially for those who's taking exam of June. Practice with each other, and you have a list of those who taking June, and you can just directly contact each other through Zoom,
Yes.
through school. But Sahar, I don't know. Maybe it's late on your time. Maybe you're hungry. You didn't eat. But the way you performed from grammatical, from English, from answering the question was perfect, but I didn't feel you mastered the station. You were very low tone. You were
Monotonous, yes, I agree.
monotonous. And imagine you have an exam for 18 station, and this was your last station. If I were your examiner, I won't pass you on this. Even though you did the best, but you were very unsympathetic. You were just like answering the question like, get out of my face for the patient. And sometimes when the patient tell you a bad story, I feel you are happy about it. You know what I mean? So
Yes.
do your best to not lose your energy throughout the exam. Do that on the day of the exam, starch corn, starch corn. Starch corn or no?
Yes. Nisha.
Eat starch corn in the morning if you don't have allergy to it. This will keep you. It does release glucose in 8 or 6 hours. Don't ever eat any high glucose sugar before your exam or during your exam, because if you eat high glucose, this will lead to activation of pancreas and insulin running out your blood, and then you're gonna feel tired afterward. So no chocolate, no Snickers, no sugar, no biscuit. Yeah, rebound yes. No rebound. It will be hypoglycemia, not hyper. Rebound hypoglycemia, and make sure you eat oat salad. Because what I saw now is just low energy. Don't ever like.
Yes, I am low in energy, and it shouldn't be an excuse. I'm sorry.
Prepare yourself like to have your energy throughout the exam. During the rest station, they will give you biscuit and the stuff in the rest station. Don't eat the biscuit. If they have banana, don't eat apple also. Apple will make you very hungry. If they have banana, orange, eat it in the station or drink water, but don't eat their biscuit in the station. I will make a lecture for those on June before their exam. I will tell you all the techniques that you can use, because this exam is not about your knowledge, it's about your technique. It's very important. Okay, just be more sympathetic. Muhammad?
Inshallah, thank you.
Both of them deal with the case as reality. Appreciate that, Asia. Sahar, in my opinion, I think you mastered the case. Just the point Ali mentioned before, which is you need to show your empathy, not just in your words, but you need to show it in your voice. As increase and decrease your.
I'm really sorry.
But you answer all questions. You summarize the case. Excellent.
Don't forget there is a person in the exam who's not a doctor. He's not a doctor. He's just looking how you speak, how you look, how you use your body language. That's his only job. He doesn't know medicine. All right. All right.
Thank
Okay,
you.
that's fine. Next.
The next station is the total knee replacement, but we are confused, Ali.
Why we confused? The first one who used the
I'm
first
not
one.
sure.
Okay, let's go to the Telegram real quick.
We have already Asia, but
The problem that the last topics of arthroscopy have been written in two ways. Have been written as arthroscopy
Yes.
and yeah. But it's totally fine. I can do the total knee.
Okay, so who's doing the total knee?
Me.
If you reach agreement, that's fine. Or we can do for both of you. I have no problem. We can do it twice.
No, Ali, we have Hajar, he have a station here. She said that he have a station of, I think, arthroscopy or total knee replacement.
Also,
I think
Hajar
okay.
choose total knee replacement.
total knee replacement, Hajar.
so I'm left.
No. Asia
Okay.
and Hajar, both of you
Asia,
will
when is
do
your
the
exam?
total knee
Asia,
My
replacement.
exam is in June.
Asia, when is your exam? June.
June. Yeah.
Okay, so you're gonna and I think Hajar, her exam is later on. So either we do both, starting with Asia, or we let Hajar practice in the next one. Hajar, are you okay with this?
It says here, Asia chose cancel operation, Hajar TKR.
Yes, which was arthroscopy. It has been written in two different ways, arthroscopy and cancel operation, and they are the same topic.
Oh, sorry for that. Yeah, that's
Hajar?
all. Where is Hajar? We just
Yes,
It's okay. It's okay.
it's okay. It's okay,
Okay.
Hajar.
It's okay.
Okay, let's-
Complete the patient and she can practice.
Okay, let's ask, yeah. Hajar, you're gonna be the patient. You're gonna be the patient for the total knee replacement. Let's
Okay.
start.
Okay.
Let
Okay,
me put
good.
a timer. Let me put a timer, please.
I need the name of the patient.
John,
Mr. Lion.
Lion.
Lion, okay.
Okay.
Let me put a timer. Start.
Good evening, Mr. Lion. I'm Dr. Asia, one of the surgical doctor working here today. I'm here to answer all of your questions regarding your operation. Will this be okay with you?
Yes, doctor.
Yeah, just feel free to ask me everything you want.
Okay. Can you share how long the operation typically takes?
Usually this kind of operations takes a couple of hours, but I cannot give you a precise time because it depends on the your body response to anesthesia and the time you're going to take to recover.
I see. What are the complications I should be aware of, the potential one?
Okay, there is no, as we all know, there is no operation that is completely free from complications. I'm sorry for the interruption. Totally sorry. There is no operation that is free from complications, so we can have probably pain or infections or bleeding or some blood clots. But we are going to do our best to make sure that none of this happened. But of course, we're going to give you some painkillers if you develop some pain, and we're going to arrange you with a physiotherapist who is going to be with you as fast as you go out from the operation to prevent any stiffness that could happen.
Okay. I'm afraid of the blood clots, how it will be prevented.
Yeah. That's one of all of the operation problem. We are going to prescribe you some blood thinners, but this has to go with some other modalities, such as you have to keep yourself fully hydrated, and also to maintain a regular movement, not to lay for a long period in the bed. And there is what we call it stockings. They are like socks, a longer one, tighter one. We're going to teach you how you're going to put it. All of these modalities should have lessened the risk of having blood clots.
I see. Can I have breakfast in the morning of the surgery?
Actually, no. because all of the operation require, or because the anesthesia require that the patients have to be fast for 6 to 8 hours. And since your operation is going to be in the morning, so your last meal has to be at midnight. But I guess you can have a sip of water in the morning. Just make sure that you don't have anything through your mouth before 2 hours of the operation.
I see. So are they
Yeah.
going to general anesthesia?
What?
Are they going to use general anesthesia for me?
Okay, it's better to have the answer from the anesthetist himself. He's going to be here after me. He's going to discuss your case with you, whether it's going to be spinal or general. But make sure that they are going to, or feel sure that they are going to choose what is best for your health, safety, and comfortness.
I see. I don't like staying at hospital. So how long I will need to stay?
Okay, usually this kind of operations, the patients take like 3 days in the hospital, but this depends on your response to the operation and the fact that you didn't develop any kind of complication and that your knee is fully capable of doing much of its function, and that the knee can be bent until 75 degrees. And also, we're not going to risk discharging you from the hospital if you're not completely safe.
I see. So if I was, when will be the hospital follow-up for me?
Yeah, usually the follow-ups takes place in after 6 weeks and after 6 months. You're going to come for the post-operative surgery for the assessment, and you have to make sure to catch with your GP as soon as 2 weeks.
I see. I'm afraid a little bit about when I should return to my work.
Yeah, I understand. I completely understand that maybe you need to go back to your work very fast, but it depends on what is the type of your job. It totally depends on this. And other thing is if you're now confident in using your knee, and that's your knee is functioning very well. Of course, you're going to have a follow-up with the physiotherapist. He's going to adjust all of this and tell you when it's safe to go back to work.
I see.
Okay.
So how can I walk after the surgery?
Walk?
Yes.
Yeah. As I told you, after the operation, they're going to be a physiotherapist. And the aim of all of this to make you capable of walking since the day one after the operation, hopefully.
So I can go swimming after this operation?
Actually, it's swimming in itself. It's not harmful. It could be good for your knee. It's going to strengthen the muscle. But I'm not going to advise you doing this because, you know, in swimming pool, there is a wet floor. And maybe you have to wait to become fully confident in walking in wet floors.
I see. So when can I start driving my car again?
I don't think there is a rush for this now. Maybe we have to wait up to 6 months in order to ensure your safety.
I see.
Yeah.
Regarding traveling, how soon can I travel for this operation?
You know, after any operation, we don't recommend the patients to travel soon, because air travel, especially if they are going to through planes, because air travel carry risk of a blood clotting, and with the operation, they're going to increase the risk. But if you are using any other modalities to travel or facilities such as train or cars, it's not going to be harmful, but you have to be regularly walking or moving.
I see.
Yeah.
Okay, thank you.
Okay, Mr. Lyon. Okay, Mr. Lyon, there are another thing I need to address first before we conclude all of this, that if you feel after the operation any redness or swelling after the operation, after the discharge, it's completely normal up to 6 months. And also it's completely normal to feel hotness over your knee for 1 year. And of course, you're going to be taught about all of this. There is a booklet you're going to have, so to know when it's dangerous and when it's normal. In conclusion, so you're going to have a total knee replacement today. And there is a physiotherapist who's going to catch for you after the operation immediately. You're going to have a factors that's going to decrease the events of blood clotting and painkillers as well. Feel free to ask me everything. My phone is with the nurse. If you have any inquiries, just don't hesitate to call me, okay?
Okay, thank you, doctor.
Okay, thank you, Sulaya.
Good. You finished with the time. I think you still
40
have
seconds. 40 seconds remain.
Fine, that's good. Asia,
Yeah.
good presentation and had a good patient simulation. You also lack energy in your presentation.
Yes, I like energy overall.
Yes, so yeah, but
it's becoming very stressful near the exam.
Sorry? Diving 6 weeks, yeah. That's one of the mistakes.
Your voice.
You said 6 months. And I think that was a mistake of energy too. You were not too focused in the diving. You said 6 months.
Oh, I said 6 months? Okay.
Yes, and there's only one simple grammatical mistake when you say all patients have to be fast. That's wrong. All the patients have to be fasting, right?
Or has to fast.
Yeah, but not has to be fast. Keep your energy up while you're practicing.
Hopefully.
I want you to review this session. We're gonna upload immediately to the course that you only have access for, and then listen to yourself. You lost your energy. You became monotonous, and this is the examiner will. Now I'm not a body language expert. On the exam, they will bring someone who is who has a degree in reading body language. So he will be easily able to detect your energy. And this will affect your score. This exam is not objective. It has a lot of subjective element to it. If your examiner thinks you are not or a pass, you will not pass you. From your presentation, you're gonna pass definitely, but keep your energy up, be less monotonous. Did you read this station from school?
Yes, but not recently.
Yes.
Did you have an update?
Yes, we updated that when your patient asks you, can I have breakfast on the morning of the surgery? Your answer is stable water, that's fine. But what we do here, we always prescribe IV fluids.
Okay.
For patients. Okay. And the updated
so no even
and we also will prescribe IV fluids for you. So we'll prescribe Hartmann.
Yes.
1 liter in 8 hours. But you don't need to mention the details. But you just say we'll prescribe IV fluids. Okay?
Okay.
And your exam in June, right?
Yes.
You're gonna pass, inshallah.
Yeah.
Just make sure you don't lose your energy.
Yes. Yeah.
Okay, Mohammed.
Rest for a little while. Okay. Thank you very much.
Thank you, Asia. Excellent presentation. I just wanted to remind everyone here, if the patient asks you about the possible complication, when you mention this complication, please answer some resolution as you say pain, we will provide you painkiller. Clots, we will refer you to the physiotherapist who will recommend a good exercise for you. Every complication you mention it, put to a solution. And
Yes. And it's already, Mohammed, just I want to add, and it's already written this way in school. We said, yes, some complications include bleeding, stiffness, pain, clicking, infection, and blood clot. But don't worry, we will do our best to avoid these complications. For the pain, we'll provide you with painkillers and we'll recommend it to therapists who will get suitable exercise to avoid the clocking and the clicking and the pain.
And for clots, the most
Dr. Ali?
important is mobile. Keep mobile.
Yeah, with the mobility. You said that, I'm sorry, you said that you're going to give us a lecture about what to do at the day of the exam, what to eat and
Yes.
what not.
Yes.
Okay.
So we will make
Also-
the exam is in 3rd of June, right?
No, mine in 7.
Okay, so we'll make lecture for 1st or 2nd of June of the techniques. We're not gonna discuss anything medical, just how to approach the exam non-medically, the techniques of non-medical. Yeah, Muhammad?
Okay, a point about if the stimulator asks you a question, you don't know how to answer it. You need to make your answer perfect as much as you can, as how can I took this blood thinner medication? If the stimulator asks you these questions, as the example of answer, I will discuss it with my consultant and I will come back to tell you.
Yes. Good.
Yes.
Or I will discuss this with my senior and get back to you. Good,
Next.
Muhammad. Next
The next
station,
station.
colonoscopy.
Yes.
Colonoscopy, Alia.
Mm.
Who want to be the patient for Alia colonoscopy? Just follow school.
I can be the patient, no problem.
Selma, is there anyone rather than Selma? If there is no one, we will give you this station.
You want me to be a patient? Okay. Sorry for my voice because I have chest infection.
Welcome back.
Hopefully
No, I'm
speed
here.
recovery.
I'm here with you all the time. But my voice.
I know. We just saw your camera. That's why I said welcome back. I know.
Actually, because I have severe cough.
We have a moderator who's following up with everyone. There's new names, Muhammad. We are not aware of.
Yeah, there are Ibrahim. Who say
we'll
my
discuss
best.
this. We'll
my
discuss
best.
this.
Yes.
We'll discuss this later.
Okay.
Let's start.
Colonoscopy. Please let me put timer. Alia,
Yes.
are you ready?
Okay.
You know the scenario and the name
Yes.
of the patient. Okay, start.
Yes. Okay. Hello, Mr. Jack. Hello. Hello.
Muhammad Kamal?
You want me the sorry.
Yes.
You want me the patient? I'm the sorry because I was okay. Just let me open the school because
Okay.
I did. Yes, hello. I'm with you, doctor.
No. Start from beginning, please.
Okay.
Hello, Mr. Jack.
Hello. Welcome, doctor.
I'm Dr. Alia Musa, one of the surgical doctors working here. I would like to discuss with you the procedure that has been arranged for you. Is that okay?
Go ahead, doctor.
Okay. Before I start, can I know what do you know so far about it?
Well, I know that you have some kind of management. You want to do some. You want to see what's happened to me. That's why with this procedure.
Okay, that is all right. The procedure is a colonoscopy involving flexible tube with attached small camera, as known as endoscopy, and this will be inserted in your back passage, okay, to provide detailed image of the bowel lining, and also we may need to take a tissue sample from the from the bowel lining, and this will be under sedation. We will give you sedation medication in a vein through a vein in the back of your hand. Okay, and also you will given laxative to clear your bowel and let us to see clearly. Is that okay?
Okay.
Mhm.
Is this any alternative for this, some kind of this camera?
Yes, okay. There's other alternative, barium enema, but will not give a detailed image and detailed information like endoscopy, colonoscopy. And also, we cannot be able to take a tissue sample if we need.
Okay, I think I will go with the colonoscopy. But what about any risk about this, some kind of colonoscopy?
Mr. Jack, I understand your worries, but you have to know every procedure has a risk, and these including sedation-related issues, and also maybe bleeding from the side of sample, and also maybe cutting through the wall of your bowel, and this may need surgery repair. Okay, and also there's possibility of incompleting the operation, the procedure. Sorry, but you have to know that. So you have to know that only a skilled and experienced doctor who is the one allowed to perform such procedure.
Can I eat and drink normally beforehand?
This is nice question. To ensure clear view, you have to maintain a low fiber diet and drink fluid 2 days before the procedure, and the day before you have to stick on clear fluid.
Okay, what about my blood pressure tablets? Should I take it in the morning of the procedure?
Okay, no problem. You can continue your regular medication in the morning. It's okay.
Also, I have aspirin. Should I take it also?
To avoid the risk of bleeding, you have to stop 7 days before the procedure and resume immediately after it.
All right. How long until I get the result of the tissue sample?
It will get the result after 2 weeks. Okay, but don't worry, I will arrange appointment for you in outpatient clinic to discuss the finding.
Okay.
You have any other question?
No, thanks, Doc.
Are you ready to sign now?
Yes, I will sign for you now.
There's only one question, doctor, I forgot to ask you. Will I be awake or asleep?
Because she said that she in sedation, that's why I skipped this question.
Yes,
That's,
she explained that in first.
she explained that. That's why I skipped it.
Yes.
I know. But I won't have to answer.
Okay,
You
sorry.
will be, you will be sedated. You will be awake, but sedated.
All
During
right.
that, you will not.
I just want to make sure. That's fine.
You
You still have 4 minutes.
Can
4
I
minutes.
continue?
Yeah.
Okay, now you sign already, okay? So, Mr. Jack, to summarize what you are here for colonoscopy. I explain for you the procedure, and it will be under sedation. And also explain for you the benefit and the risk of this procedure and the alternative option. And you signed consent for this. And you have to know that you are here to help you and support you. Don't hesitate if you have any question to ask. I will leave my contact number with the nurse. Thank you.
Good. There's 2 things. Either you are a good student or I'm a good teacher. Aliyah, good presentation. You didn't miss anything. And Muhammad Kamal, he was very good patient. She was very engaging. Yes, the way you say nice question, good question, that's very good. And Saleh also used that. Asia and Sahad. Just encourage your patient. Yeah, that's good question. Yeah, good question. I'm glad you asked that question. And I'm happy that I can tell every one of you listen to the video that we made. I can tell. So that's very good. I'm very happy with the performance today. It's quite nice. There's only one point. You said we explain. You either say you should say we explain. And you said let's summarize what, and you said nothing. Let's summarize what we went through, Alia. Like everyone should memorize this sentence because you're gonna use it. Let's summarize what we went through today. Or let's summarize our discussion today. Okay? We explain, don't say we explain, we just explain. Everyone should learn the way of saying, yeah, good question, reassuring your patient. And if the patient stops to ask you any question, you encourage him. Muhammad Kamal was very good patient. He asked you all the questions that he's supposed to ask. So I'm happy with the performance. I don't have any other point. Just say we explain. This is the only grammatical error I noticed. And let's summarize what we went through. Don't just let's summarize what and let the sentence blank like that. Just complete your sentence. Okay? Muhammad. Does anyone have any point regarding this?
Very good, Alia. You answered all questions, and also she showed empathy. It's the most important thing in communication skills. Some guys ask about what he wanted to tell about the summary. What's the most important words you wanted to tell the patient about in the summary? Just mention the purpose of the scenario and some benefit and risk is the scenario about some procedure like colonoscopy or endoscopy.
Yeah.
Thank you very much.
Okay, last one, right?
Jehovah Witness.
Yes, that's me. Same scenario, or you want to change the names?
Same scenario, same as the school.
Ali.
Okay, who will be with me?
We're asking for the group
I
now.
will be
Yes.
the patient.
Okay.
And I think the patient and examiner in the same way.
Okay, let me put the timer for you, Muhammad. Let's start.
Okay, hello, Mr. Robertson. I'm Dr. Anderson, one of the surgical doctor here. I have came today to discuss with you the operation about your operation about removing of the brain tumor. Is it okay to speak with you?
Yeah, doctor. It's fine.
Can you please tell me in brief, what do you know about it?
Of course, doctor. I know I am having an operation to remove a brain tumor. Is that it?
Yeah. Hello?
Yes.
Hello?
Did you hear me?
Yes. Yeah, exactly. This operation will be done. Your brain tumor will be removed. It will be a challenging and big operation. That's why I want to take your permission that we want to prepare. Maybe you may bleed inside the operation. That's why we want to make sure that you have prepared for you the cross-matching and prepare blood in case we need it. Is it okay with you?
Doctor, my religion didn't accept blood transfusion, even if become necessary during the procedure.
Certainly. Let me explain for you this operation because this is the brain tumor inside your brain that it's a very big operation that we may because we may not even able to remove whole the tumor. We want to hold. Sometimes we are not because of the bleeding. We may stop the operation, and there is high also risk and high chances of you getting stroke or high chance of mortality.
Could you tell me about this risk rather than you said stroke, I think.
Sorry?
What the risks you mentioned?
Yes, it's high risk because of the bleeding. That's why I want to make sure that you are prepared, well prepared beforehand.
I know that, doctor. I don't want the blood transfusion.
Well, I do understand your situation, and I want to make sure that I do respect your religious. But please, for recapping now, can you explain for me what information did you get from me up to now?
Yes, you told me that I have brain tumor and there are some risks of bleeding during the procedure and stroke, and my baby die during the procedure. But
Yes.
I don't accept blood transfusion, doctor.
Okay, that's good summarizing. In such a case, we in our policy in our hospital, we have to sign some papers for this documented that you're refusing because you refused for documenting refusing the operation. Is it okay with you, sir?
Okay, give me the paper.
All right, that's fine. This station has a lot of discussion. Very good. We're gonna start the discussion with the examiner. It's a short station, but it has a discussion. How can you ensure that the patient is capable of making his decision, doctor?
First of all, I want to make sure that the full capacity of the patient, I want to ask him that I want to make sure that he can recap the information, analyze the information.
All right. And whom would you notify about the decision?
Well, the
That
decision.
he's not accepting blood?
Sorry?
Whom you're going to notify that your patient is not accepting the blood? Who will you?
I want to get discussion with the neurosurgeon who was taking the operation, the anesthetist, and the theater team.
All right. And let's say your patient didn't accept the blood. What's the precaution that you're going to do, even though he didn't accept the blood?
We want to make so this patient is so precious. So in multi levels, in the pre-operation, we want to make sure that his hemoglobin is okay, and we want to make sure that of other measurements like erythropoietin, IV fluids, and other blood components, and intraoperative. We want to make sure that there is a good communication, and the operation will be very fast, and there is communication between each doctor inside the operation. And after that, after op, we want to make sure that close monitoring of the patient's symptom and sign, and hemoglobin monitoring of the patient.
Okay, and how you will conclude and summarize the discussion between you and your patient?
First of all, I want to make sure that he is recapping and analyzing the information. Because I want to assess his full capacity, and also want to make him do signature for the legal documents paper for signing of DAMA, discharge against medical advice, and we will document this also.
All right, good. You still have 3 minutes and 40 seconds.
Sorry.
Good, Muhammad. Good presentation. Yeah.
Muhammad, just in pre-operative.
Sorry for my infection.
For pre-operative measurement, you need to mention tranexamic acid.
Yes, I
Yes.
forget
Most important
this word. I'm trying to fetch it. I forget it.
Okay. I wrote it here. Look,
because antifibrolytic effect. Yes.
Yes. But Muhammad, your presentation was fantastic. Fantastic.
Sorry for my cough. Sorry.
No, that's fine. Good presentation. Did you miss anything for the rest of the group? Do you want to add anything? All right. Any new question regarding the station that we just discussed now?
Now I have a question.
Yeah.
About the summary. Should I make the patient do the summary, or should I say the summary?
Okay. Firstly, if you asking the patient for a consent, you want to make sure that your patient can retain information. So you will ask him for summary. After your patient gives you the summary, then you're gonna conclude the discussion all over together. So if you have a patient who needs consent like this one, or you have a DAMA patient, that's you. In this case, you're gonna give the summary first, then you're gonna ask. No, you're gonna ask for the summary first. You wanna make sure your patient is able to return information. But in the case of the lady that the CT discussion, for example, the CT. In the CT, you are not taking a consent. You will just give the patient the summary. You don't want the patient to tell you the summary, because the purpose of the summary from the patient is to make sure the patient consented while he has the mental capacity to do the consent by returning the information. Do you understand the point now, Muhammad?
Yes, yes, yes.
You ask, you give the summary in the cases that you don't need a consent. You take the summary from the patient, then give it back to the patient when there is a consent involved. All right?
Okay.
Okay. We finished our session for today.
I have a question, please, before finishing the session.
I just want to make a small note.
For arthroscopy, there's like extra 2 questions.
Yeah, please, Saleh. Yes. Yes, tell us. Pulse. Okay. Patient association.
The patient may tell you, I want to file a complaint.
Okay, we need to add that one. Let's add it now.
I'm not happy and I want to file a complaint.
Yes, fantastic. Okay, let's add this question.
Yes, I didn't hear the question.
In the arthroscopy, in the cancelled operation arthroscopy, Saleh.
Yes.
Okay.
He may tell you that I want to file a complaint.
Okay. In this case, you will tell him go to PALS, right? Yeah.
Patient advice and liaison service office. Yes.
Yes. That's it.
Okay. Muhammad Hassan, I think you have questions. You are me.
Saleh, you said 2 questions.
1 minute.
Saleh, you said 2 questions.
Well, the other one may ask you, how will the arthroscopy procedure be done? Can you explain it to me?
All right.
Like inserting
through
a probe, containing
keyhole.
camera and TV screen and blah.
Yes.
Yeah, a keyhole where the camera is inserted and it relays the picture from within to a TV so we can see what's happening inside.
Yeah.
All right, that's fine. And then how the arthroscopy is done. Who's answered? Is it Sahar or Asia?
It's me, Sahar.
Okay, can you send me these 2 answers to Telegram or send it to the group?
Sure, inshallah.
Right now, yes, so we can add them.
Okay.
I just wrote the question, yes. and I will update them to school. Okay.
Yes, I have a question regarding the angry wife on the broken CT, and one of the new questions I hear about that the wife was believing that during the discussion that her husband condition, this means the cancer, is related to his work, and she's planning to establish a case against his employer. So I'm asking, what is the wise answer in this situation? Thank you.
Muhammad, I think you're speaking very fast. Can you just say that again slowly?
Yeah, I hear about a question in such stations, broken CT, counseling an angry wife. That the wife during the discussion, the wife was believing that her husband's condition is related to his work. So she mentioned that she is planning to establish a legal case against her husband's employer.
Okay.
So what is the wise answer in such situation?
Okay. In this case, you will tell her, okay, let's say now it happened here a couple of times. In this case, you will tell her, okay, there is legal authorities for these matters. I won't be able to advise you. There's a legal committee in the hospital, you can speak with them. I can provide you with the number or the email. You can have a discussion with them. You as a doctor, you have nothing to do with the logistics.
Yeah, I see. But
you're just being diplomatic by divert her